A federal settlement with the Cleveland Clinic is drawing sharp reaction tonight, praised by some as protecting children, but criticized by others as abandoning them. The clinic has agreed to a 20-year deal barring gender-affirming care for minors and pay over $2 million. Hunter Bertram joins us now live at the clinic to explain. Hunter.
Yeah, Lena, the agreement covers gender-affirming care for minors, including puberty blockers and different hormone therapies. And while already state law prohibits hospitals from providing this type of care to minors, what this settlement effectively does is lock in that policy at the Cleveland Clinic for the next 2 decades, despite any future changes to the law.
You're completely restricting the ability for young people to get the health care that they deserve.
A major blow, some say, to Ohio's transgender youth.
Our focus right now is on the youth and the families that woke up this morning, received this news, and now are wondering, what does this mean for them?
This settlement stems from allegations that Cleveland Clinic submitted questioned Medicaid billing codes for some minors receiving cases related to gender dysphoria. Federal officials say incorrect diagnosis codes were used. The clinic told 3 News Tuesday afternoon it was an unintentional coding issue involving a small number of patients and does not admit liability.
I received gender-affirming care as a minor. It started at about 15 years old.
Aaron Sawyer, a Canton trans man, now 22, says he began gender-affirming care at Akron Children's, later continuing care at Cleveland Clinic.
What a lot of people don't realize is that without proper access to gender-affirming care is that it really is life-saving for youth and adults alike.
In announcing the settlement, the Department of Justice said it is, quote, steadfastly committed to protecting America's children, end quote, said Associate Attorney General Stanley Woodward.
I really feel like the further they push restricting minor affirming care, the closer we get to them restricting adult care.
The agreement also prohibits Cleveland Clinic from referring minors for those services, coordinating care through third parties or operating facilities that provide the treatments. In Ohio, House Bill 68 already bans gender-affirming care for minors, making this settlement in practice a long-term extension of that restriction at Cleveland Clinic, staying in effect even if laws change.
Just because you restrict people from being able to access care, that doesn't eliminate the need for care, right?
And Cleveland Clinic will pay $308,000 to resolve those false billing allegations, and it's committing an additional $2 million for restorative care for people who have detransitioned. Lena.
All right, Hunter Bertram reporting live from the clinic tonight. Thank you.